Guys, I'm so upset. I was just talking to myself for like 20 minutes telling myself all about the Emgality injection and then realized I wasn't recording. So that was super duper fun. Anywho, hi, my name is Casey. I'm going to take you along with me with my monthly medication for migraine prevention today and give you some of my tips and tricks I've picked up along the way, talk a little bit more about the medication and things that I do to help make sure that I have this habit, things that I do for pain management, etc. I will also make sure that I have like chapter breakdowns for different parts of the video if you are trying to skip ahead or look back at a certain portion or whatever. So hopefully that helps you. First, a little backstory. I've always had migraine, okay? I've always had it. I remember first getting symptoms I was aware of at age 10, and most of my life with migraines since then has been some sort of severity between chronic migraine, which is 15 or more attack days a month, to like constant migraine where it's like I get symptoms every day. That may not even be true anymore because I've been kind of out of that space for a while now. Maybe I need to go back and run the numbers, do the math, but lately I've been more in an episodic period where it's 2 to 3 attacks a week. So that's like 8 to 12 attack days a month, which is still kind of frequent, of course, obviously, but I'm in a much better place, obviously, with that. My attacks are pretty easy to treat as well now, so that's a big plus. That has not always been the case. But I actually do think that the shift happened for me from that constant/chronic to episodic when I was prescribed one of these new CGRP medications. So let's talk about that. Due to my extensive history with migraine, I have gone through a lot of medication regimens for migraine prevention, and a lot of them have like failed, of course. So whenever this like new class of medication was presented, I don't know if this is still the case, but in order to be able to have it prescribed and somewhat covered by insurance, I had to like prove that I had failed other types of migraine prevention medications, which was very easy to do since I had a lot on my roster. So it was not a big fight to get onto a new type of medication. We're gonna be going through the Emgality medication today. I was originally prescribed Aimovig, and personally my experience with Aimovig and Emgality have been pretty much identical with one caveat, but like effectiveness wise, very much the same. And again, if you're living with migraine and have gone through a whole host of different types of medication regimens, you know that you do have to trial different medications for several months to determine whether they're effective or if you should even keep taking them, that kind of thing. So whenever I was originally prescribed, I think my follow-up appointment was for like 5 months after we started the medication. But I was seeing results within the first 2 months for sure. I don't remember the exact details of that anymore because it's been a while, but like I did have pretty quick results with Aimovig. Like it was a noticeable difference. I knew it was helping me. Yeah, and I've been on these medications ever since. I don't know, let me think math-wise. I probably was taking Aimovig for 1 to 2 years, maybe longer, maybe shorter. Time doesn't mean anything to me. Of at least a year. I actually moved, so whenever I established new healthcare and started seeing a new neurologist, that was when we changed to Emgality. I wasn't like unhappy with Aimovig or anything, and I don't think there was a real reason why I switched. It was just kind of what the practitioner I started seeing ordered, and I was like, that's fine, and I didn't notice any change at all. So with like how effective it was for my management. So that was really exciting, and it has been consistently helpful for me. So side effect wise, let's talk about that. There's only like one consistency between Aimovig and Emgality I've noticed, and it actually hasn't even been a problem for me for years now. It's so hard to describe exactly. So wherever you do the injection site, I do it in my thigh. I tend to get skin irritation. It like sensitizes the area, okay? With both different types of medications. It wasn't right away, but a few hours after doing the injection, I would notice like white, puffy, inflamed skin around the injection site area. But it would like go away within a few hours. Like it took a few hours to present and then it took a few hours to go away. It was like itchy and obviously inflamed, but like not severe discomfort or anything like that, and nothing serious and nothing long lasting. And that actually hasn't even been happening to me for years now, so I don't really know what changed, but I don't get that reaction anymore. And I usually didn't even really notice it significantly anyways, because it tended to come up like at night, so I'm like asleep, I'm not aware of it. I would notice when I'm getting into my pajamas is like, that's when I'm like, oh, my skin is getting weird, but it was gone by the time I woke up. But yeah, that's kind of been the pattern. After that resolved, I noticed kind of a new variation of that symptom where I could not wear band-aids anymore. It was really weird, and I still don't put band-aids on my leg after the injection. I don't bleed a ton, so it's not a big deal. I just kind of sit there, like maybe dab at it and wait for it to stop bleeding. It doesn't bleed much, so then I get up and go, you know, I'm done. I don't need to wear band-aid. But it's weird because I can wear band-aids in other areas after other types of injuries, and I use other latex containing products. It's not a latex allergy, but like it would cause skin reaction too when I was using band-aids after the injection. So I think there's just something about it that sensitizes my skin, maybe. I'm not totally sure, but it's been very easy to just like not wear band-aids in that area. And nothing's been happening to me since I stopped using band-aids in terms of reaction on my skin. The only other side effect I'll notice, this is the only thing I noticed a difference in between Aimovig and Emgality. Everything else has been the same in my experience. Aimovig caused constipation, which was such a weird thing. Like I just had never experienced that before, and it wasn't like severe to the point where I was uncomfortable or anything. I would just notice like something like time-wise, this isn't making sense. Like this is weird, like constipated frequency rather than what I was used to prior and what I'm used to now. It again wasn't a big deal to me. I actually was taking I started a magnesium supplement, which also is helpful for migraine management, and it was magnesium citrate, which has like a laxative effect, and that really helped me manage the constipation while I was on Aimovig. I'm realizing as I'm saying this out loud that I have forgotten all about my magnesium supplement. I should probably bring that into my routine again. I forgot about it. But yeah, that symptom, I suppose, or that side effect went away when I went to Emgality. I don't notice that effect. Now what? What should I talk about? Let's talk about the fact that I have a really bad memory. I also have ADHD, and I have a really hard time forming habits and not procrastinating things and like being forgetful. So I used to initially have a hard time remembering to take the medication monthly. Like obviously it would show up at my pharmacy once a month, but then I would procrastinate picking it up. But like I used to have a really hard time remembering to take it on an exact day. At one point, I was recommended to take it and time it a week before my period would start, because my most significant issue migraine-wise is menstrually related migraine, where those attacks are very hard to treat and they cluster around my menstrual cycle. And that worked for me for a while because my pattern was very consistent, where I would get very specific symptoms exactly a week before my period every month. Like it was very orderly. It was very nice. I no longer am. Then I stopped being consistent. Like my schedule, Then my cycle became quite irregular, and that was not helpful for me at all. But what has been working for me for a really long time is kind of having a due date of the first of each month. That's just like very easy to remember, obviously. But since I am a chronic procrastinator, I have like a grace period, and I think of it the same way that we think of rent in at least this apartment complex. I don't know that this is universal, but rent is like due on the 1st, but it's not actually like due until the 5th. Like you have until the 5th to pay it, but it's like pay it on the 1st, but you're not in trouble till it's the 5th. Does that make sense? So it's kind of how I treat my medication, because today's the 3rd, for example. Like I did forget to pick up the medication at the pharmacy the last 2 days in a row. Whoops. To piggyback off of that, something that has really helped with my motivation to remember and like get me going to actually do my medication is my dog, okay? My husky Kyla, you'll see her later. She also has monthly monthly preventive medications. She takes, well, I'll get them here, they're right here. She takes HeartGuard, so for heartworm prevention, and she takes Canine Advantix for flea and tick prevention, like disease stuff. I get way more anxious about dilly-dallying on her healthcare more so than mine. Like it's much more important for me to take care of her than myself. So I have been driven by anxiety and shame to go to the pharmacy today, because I'm like, my girl needs her medication. We call it the girly medication day, where we both take our preventive medication for healthcare. She's fine with a couple days late. It's really not the end of the world. Nothing's gonna happen with me giving her medication on the 3rd instead of the 1st, but it is a major driving factor to get me to pick up my Emgality, okay? And low-key, let me tell you, I almost thought about just giving her medication on the 1st, but then I knew in my heart of hearts that I was never gonna remember to go pick up my medication. So that's why I held off. I knew that I would just like never make it to freaking Walgreens if I had not, like if I didn't have that driving factor of she's not getting her medication until I'm getting mine. Like I knew that I had to do it this way. This has been very effective for me, okay? So later on, after I do my injection, I'll show you her getting her medication too, because I know you're gonna wanna see her. She's a lovely little girl. Let's see, what else do I need to tell you before I do it? Oh, another memory-based thing. So this also can go hand in hand with like the pain management stuff that I'm gonna talk about next. But there's different site options, and I'm gonna have linked below like actual information about like instruction for use for Emgality and stuff like that. So like I'm not necessarily spreading misinformation. I'm gonna make sure that you see how they are telling you to do the thing. But I know you can either use your upper thigh as an injection site or your stomach. I hear that pain management wise, the stomach is more comfortable, less painful. I will never find out because I actually have a major phobia of belly buttons and I'm getting anxious thinking about that. So we're just gonna blow by that topic. I don't want to talk about that right now, but like any area on the stomach is just too close for comfort. I'm not gonna do it. It makes me too anxious. So I use my thighs. And since I'm using my thighs, and this is probably true for stomach area as well, you need to rotate the injection site. So once I realized that that was very important, I got very stressed because I was like, how do I remember which one I did each month? Like that was freaking 30 days ago. There's no chance I'm gonna remember that I did my left leg last month. Like it's just not gonna happen for me. I can't remember things like that. So I kind of flopped my way through that for a while, but then I came up with a method that's really been helpful for me. And I feel like I explained this in a way that's more complicated than what it really is, but stick with me. So I've assigned each month the number 1 through 12, which is January through December, in case, I don't know, we're confused or something. All the odd ones, January, March, May, July, etc. Those odd ones I've assigned to the left leg. Odd is left. That just makes sense to me. And then the right ones, 2 through 12, February, April, June, etc., are the right. So left is the odd numbers and right are the even numbers. I hope that makes sense. So like today, sitting here right now, I'm like, I don't know what I did last month. I couldn't begin to guess, but I think about what date it is. We are in April, so that is the 4th month of the year. So that is even and the right leg. So I love that. That makes it so much easier for me. It's like the only way I'm gonna remember to do it correctly, right? It's been a big game changer. It's so simple, but it really has helped me. Now let's talk about the pain management stuff. So first things first, I don't know how much of a difference this super duper makes, but whenever you pick these up at the pharmacy, they are held at like in the refrigerator in the pharmacy. I feel like I'm saying that weird, but like if you picked it up days in advance, you'd want to put it in your fridge at home. And I've done that before, but usually I procrastinate and I have to take it the day that I pick it up, like today. So the thing that might help with pain management is letting it kind of like thaw to more so like room temperature. I don't know how much of a difference that super duper makes, but I can see why it makes sense. So I usually do leave it like on the counter for at least an hour. And I suppose that might be helpful. I don't know. Then for the actual injection part of it. Now, first things first, let's not freak out about this. Yes, it is painful. You are stabbing yourself with a needle and injecting medication. It's gonna sting because that's what it is. And I think part of the thing that gets me worked up and anxious about the pain is the fact that you're doing it to yourself. You press a button and it injects. So you are causing the pain yourself. And that freaks me out personally, and I'm sure it freaks out a lot of people. It's not super duper painful. Yes, it does sting. But for me, like when I do find myself starting to get all worried about that, I try to think objectively about just like how much pain it is actually saving me down the line. Like it's maybe like 2 to 3 seconds of, ooh, that stings, versus like 15 days of debilitating symptoms that it's saving me from. So like, it's pretty much no questions asked for me, but I do understand it is something that's painful and something to think about. So there's a couple of ways that I find helps me with managing the pain while I'm like doing the injection. One of them is the thing that I do most often, which is just timing my breathing. with it. So like as I'm like gearing up to press the button, I'll inhale, and then as I press, I'm releasing the medication, but I'm also releasing the tension and stress from my body and exhaling. And that is super duper effective for me. The thing that I did first was just making sure I was keeping my brain happy and occupied and distracted, like watching TV or something, just so I'm not fixating on that I'm about to do it. So like just keeping myself a little bit distracted, and I'm just like paying attention to show and click the button. I'm like, oh, that hurts, but I'm like watching something. So like that distraction factor helps me with pain management. And then the other thing, of course, this just does help people with management of pain, is cursing. So it is just a proven effective method to say some sort of expletive, is that correct? I don't know. And that helps with the pain management. And I don't curse much, but I actually do cuss a little. What's your favorite word? Okay, let's not do that. But I do curse kind of consistently while I'm injecting myself and stabbing myself in the leg, but I do find that the breathing thing helps me a lot. Okay, I think I've dilly-dallied enough. I think I'm going to sanitize, prep the area, gonna do the injection. I think I'm gonna like take the camera down and give you a view of it. I'm not totally sure how that'll go, so don't hold me to it, but we're gonna try to do that. And once I'm done, we will give Kyla her medication, her like doggy preventive medication, finish up the girly medication day, and we'll wrap it up. So you can probably see the medication fluid in there, the clear liquid. That is what we're going to be injecting. Couple things, there is a lock mechanism here, so it is currently in the lock position, so we need to unlock it. There's also this protective thingamajig here that we're gonna have to take off, so I'm gonna do those things. Okay, we are all good. It is unlocked. We're ready to go. The needle is set. I don't know how much you're gonna be able to see here, but oh, I'm getting anxious. I also find myself like fidgeting when I'm doing this because I'm like, oh, I don't want like my muscle like flexed, but then I don't want it to be like, I don't know. I start getting all weird about this. This is when the anxiety starts building up. So I want you to try to see. I hope that it's going to have enough focus. The needle here, you're gonna see when I press this button, it shoot into the leg, and then the fluid will drain, and you'll hear some clicking as like those different mechanisms go. So I'm gonna take a deep breath in because I'm feeling myself get anxious. Okay, did you see all that? So it pushed it down, and you heard the click when it brought it back up. So it is done. The needle is back up. The medication's fully done. I'm gonna lift it here. There is a small area with blood here, but like I told you before, I have not been able to wear Band-Aids in this area, so I'm taking this sanitizer wipe in an area I haven't used yet, just dabbing it up, and it'll probably not bleed for long. So that's kind of all I'm gonna do there. I'm gonna let it dry, and then we'll get up and do Kyla's medication. So this I do first because she kind of hates it, but she likes this other one. This is a like gel that we have to put on her spine. Sometimes she acts very dramatic about it. So I'm gonna open this up and we're gonna get her over here. Here we are. So you open it up and then it's still sealed, so I have to puncture that. And now it is open and ready to go. So I need to get the dog over here. She's gonna resist. Come here, Kyla. Come on. Hi, are you gonna be a good girl today? So here's the problem. She likes to flop over on her back, and I need her spine. So come here. Come here. You know, come here. Oh my gosh, let me get the other one ready, because she views this one as a treat. You want a treat? Yes. Come here. Yes. Okay, don't flop over. So I'm lifting up her fur. I mean, this isn't for dog health care, so this isn't as important, but I'm lifting up her fur so we can get it closer to her skin. It's on her spine, so she's less likely to like lick it up and stuff. Down towards the tail, and we're good. I do hate that this makes her skin weird and oily, but I also don't want her to get sick. Good, so now I'm gonna give her her treat-o. Can you speak? Yes, can you shake? Touch, spin, sit. Okay. And that's that on that. Okay, oh my gosh, I'm gonna fall. So she's enjoying her treat. Don't tell her, it's medicine. And that's girly medication day. It's a wrap. We're both set for the month. So I hope that some part of this was helpful to you. Let me know. Subscribe for more chaos. And yeah, it's a wrap, right? You're not gonna give me a kiss? Did you like your treat? You're so cute. You're so cute. Mwah! Okay.